Hi viewers, in this video we are going to discuss about universal coverage. My name is K. Priyadarshini, working as a lecturer in Madras Medical Mission College of Nursing. Let me list down the objectives of this video. At the end of the section, the viewers are able to define what is universal coverage, enlist the objectives of universal coverage, explain the principles of universal coverage, elaborate the role of universal coverage. First, we will see what is universal coverage. Universal coverage means access to essential healthcare services to all the people residing in the country or residing in our world. No individual should suffer financial hardship for healthcare. It was not only this universal coverage, it's not only active in India. This is promoted globally by the World Health Organization. And this is the core part of primary healthcare approach. Okay, what is universal universal coverage means essential healthcare services to all the people, so that without much strain, without any hard work, the people residing in the country should get all the essential basic health services. That's the ultimate meaning. Definition of universal health coverage. It ensures the availability of promotive, preventive, curative and rehabilitative health services to all the people residing in the country. And affordability. All should be affordable to get treatment from the healthcare services, and accessibility for all the people. See, in our country, we know that every 3,000 to 5,000 population, there will be one subcenter. The same way, every 20,000 to 30,000 population, there will be one primary healthcare center. What is the meaning? What is the purpose? Why they have created this for this many people? This is the health services. Why? Because the health services should be accessible to all the people, so that the people will able to come and get the services in a proper way. So universal health coverage ensures availability of promotive, preventive, curative and rehabilitative services, affordability and accessibility to all the people. Objectives of this universal coverage: it improves overall community health. Okay, so the government is planning to give services to all the people, all the essential services to all the people, so it improves the overall community health, reduce the mortality and morbidity rate, ensure the equity in healthcare services, okay, equal distribution of services to all the people, provide financial risk protection, because see, whatever the area, all type of people will be residing. Okay, some people able to afford to get treatment for some high risk disorder like cancer, and some may not. So we this kind of universal coverage services, health coverage services, provide financial risk protection to all the people, strengthen the primary healthcare system, by which we able to strengthen the primary healthcare system of our country. So the objectives of universal health coverage: improve overall community health, reduce mortality and morbidity rate, ensure equity in healthcare services, provide financial risk protection, strengthen the primary healthcare system. Principles of universal coverage. Three main principles are there. The first one is equity, equal access for all the individual. Quality, safe, effective and patient-centered care. Third one, financial protection, avoid out-of-pocket expenditure burden. Okay, so the three main principles of universal coverage: equity, it should be accessible to all the individual residing in the area; quality, safe and effective services, patient-centered services; financial protection, avoid out-of-pocket expenditure. Okay, so the healthcare services, giving healthcare services should not add financial burden to the people. So financial protection, by giving the primary healthcare universal health coverage, providing primary healthcare services, it will reduce the financial burden of the people. So principles, three things: equity, quality and financial protection. Component of universal coverage. Four components are there. promotive services, preventive services, curative services, and rehabilitative services. We will discuss one by one. Promotive services, mainly before the disease occurs, we used to protect the people from getting disorders. Okay, that those services will come under promotive services. Health education, nutrition, hygiene, exercise, and other component or healthy lifestyle habits, and what is needed for particular classification, growth and development. All those things we used to give as a health education. Lifestyle modification awareness. Okay, based on the individual scenario. Okay, based on the individuality, we are giving the lifestyle modification. If the person is working following the sedentary lifestyle pattern, then according to that we are giving the health education. Okay, lifestyle modification strategy. If the person is not following the physical activity, we are encouraging to do the physical activity. If the person is not aware about the nutritional requirement of the particular age group, we are telling that thing. So lifestyle modification awareness, community participation program, these are all the things comes under promotive services. Preventive services. See, for I want to protect for example, I want to protect the child from flu. Then what is the next step for a preventive services? I will be going to the health care center and getting some vaccination for that. This and all comes under preventive. So immunization program, disease screening, early diagnosis and prevention, this and all comes under promotive services. Next one is curative services. Till now we have discussed promotive services and preventive services. Third one is curative services. Treatment of common illness, basic medical care at the community level. Now this is after getting disorder, we used to give this curative services. Okay, treatment of all common illness, basic medical care at community level, referral services to the hospital. This and all comes under curative services. Rehabilitative services. The last one is rehabilitative services, care for disabled individual and support for chronic illness patient, community-based rehabilitation. Rehabilitation means mainly we are concentrating on prevent from complication. Already the person is affected with disorder and got treatment. Now to maintain the stability, to restore the activity level, they are providing the rehabilitative services. Now we will discuss the strategies to achieve the universal coverage. First one is strengthening the primary health care. Strengthening the primary health care means by infrastructure, in the way of infrastructure and concentrating on 3M, man, material and money. By increasing this, we are able to achieve the universal health coverage in a proper manner. Second, expanding the healthcare workforce so that we are able to reach the people in a successful way. Improving the rural healthcare services. Health insurance scheme like Ayushman Bharat, use of telemedicine and digital health. These are all the strategies we can able to achieve the universal coverage. Importance of universal coverage. It reduces the health inequalities and it improves the quality of life, prevent the disease outbreak, enhances the economic growth, promotes the social justice. These are all the benefits if you are following the universal coverage in the proper way. Challenges of universal coverage. Okay, this is not the easy thing. Providing equal accessibility, providing, increasing the healthcare members. This is not at all a easy thing. The government is facing so many challenges to achieve or to give universal coverage to the people. The first challenge is shortage of healthcare professional. Okay. Second, poor infrastructure in the rural area. Third one, financial limitation. Fourth one, lack of awareness. Fifth one, cultural and geographical barriers. These are all the challenges the government is facing for providing universal health coverage to the people. Role of community health nurse. Conduct home visit. Second, provide maternal and child health care services, because the majority of problem related to maternal and child health. So concentrate on maternal and child health care services. Identify vulnerable population. Overall comes under vulnerable population, antenatal, postnatal, children, and the person who are suffering with morbidity. Those comes under vulnerable population. So identify vulnerable population and provide care in the home itself, so that we can able to prevent the majority of the diseases. Health education and counseling. Disease prevention and control. Act as a link. The community health nurse should act as a link between the community and the healthcare system. These are all the roles and responsibility of community health nurse in providing the universal health coverage. To conclude, universal coverage is essential for health for all. Community health nurses play a key role in providing this health for all. Strong systems and policies are required for success. Okay, till now we have discussed about what is universal coverage and what are all the importance, what is the strategy, benefits, and what are all the challenges our government is facing in providing universal health coverage, role of community health nurse in this. Thank you, viewers, for your support. I hope you are all able to catch what is universal coverage and able to explain what are all the benefits and what are all the challenges the government is facing. Thank you.